to do, we don't do it. And the reason in many cases is ideology. If we forget about this thing, it's going to go away. And 1,000 deaths a day is okay. But the virus is now the economy. Until you control the virus, you don't have an economy. Look at the economy we have down here. You talk about our beautiful waterways. People want to come to Florida as tourists, for retirement, for resort. Do they really want to come here if we're known as the hotbed of COVID Central? I get calls from friends around the world and they say to me, are you okay? Are you alive? We know what's going on down there. How are you surviving this? Okay? This is terrible for business. People want to feel safe. They want to feel that they can go to the restaurant and not have to worry about it being infected and end up in the ICU. They want to be able to send their kids to school, not wondering, is my kid going to get infected and then kill my grandfather? They want to feel safe. They want to feel healthy. They want to feel protected. And the regime that we've had in power not only hasn't protected us, but it's lied about it from day one, okay? I mean, it wasn't just in January when the president was told by Alex Azar, this could be big, January 18, and he doesn't talk to him, or in January 26 when Navarro comes to him and says, here's my report, it could be 500,000 dead in a relatively short period of time, totally neglected. But what blew my mind was when I saw that Rachel Chu, who's a flu researcher out at the University of Washington, is trying to tell the FDA and the CDC, I think I have all these coronavirus cases here. These people don't have flu. I think they have what's going to be COVID-19. I got to study them. Now, any doc I know thinking if there's an epidemic happening in my hometown, you're going to want to go out and study that and find out lickety-split, right? The FDA, the CDC say, don't do it, it's illegal. You don't tell researchers to find out there's an epidemic in your town, that's illegal. You're going to lose your grant, you're probably going to go to jail. That can only happen from the top. They don't want to know. So Rachel Chu on February 25th says, forget it, I'm doing it, and finds out they've had COVID in the town for 6 weeks. Seattle's had community spread for 6 weeks. There's all kinds of different strains going through. That day is the same day that the president is putting out with many, many different people statements that it's all okay, folks, it's all going to go away, it's not happening. And I think the most cogent of them was Kayleigh McEnany, who is now our White House spokesman, who gets up and says, the coronavirus will never come here. The coronavirus will never come to the United States. And she's not alone. There are dozens of other people saying the same thing as part of an orchestrated chorus on February 25th. They don't want to know. They're suppressing the data. They're suppressing the research. They're suppressing the science. And we have had, even since then, 6 months to set up a public health infrastructure. We've had 6 months to get the kinds of tracing and tracking and testing that the Australians have done. And the Australians, for example, are in many ways similar to us. They have fractious politics. They have a government that's conservative that large parts of the country doesn't like. But in January, they knew what they were facing. They got together, they organized things, and they've had, I think, 6 or 7 deaths per million versus ours running about 530, 540, okay? Under very similar kinds of circumstances, they're doing it at about 170th. And when Melbourne got hit a few weeks ago because quarantine was blown out, what did they do? With 191 cases, they locked the city down for 6 weeks because they couldn't find the community spread. 50% of the cases, we don't know where they're coming from. In Florida, we have 10,000 cases, and the only thing we lock down are bars. We now have created a huge viral reservoir. Very fortunately, the cases are going down, but that viral reservoir is there so that if anything causes an outbreak, which could include opening schools, which could include changes in weather, especially in the north, because the virus really likes 40, 50 degrees. Anything that points that up, we don't have an infrastructure to control it. We can't stop it. And the brush fires will just go on and on and on. We have not done the basic work that most of the world knew what to do with all that time.